Healthy mind, healthy body, healthy life. Soul food on Smooth 98.1.
We love music, we love life, we love your health, and we want you to be in the best shape always, physically, mentally, socially, emotionally, every aspect. That's why we have Soul Food Conversations every Saturday from 8 till 8:30. It's a part of Breakfast in Bed, and you're listening to Smooth 98.1. Welcome if you're joining us for the first time. We have a number of ways you can use in being a part of the conversation. There is a WhatsApp line, which is 0809 4440981. There is a call line, which is 0201 448 9981. Currently, we're streaming live on YouTube, so you can go back to our YouTube channel if you are subscribed. And if you're not, I'd say you subscribe so that you can get that notification whenever we go live. So at Smooth 91 FM Lagos is the handle. And you also can drop your comments, your feedback, your questions using the live chat option. That said, I told you earlier when I was giving an insight into what to expect on the show that today we are talking about typhoid fever. And it's one fever that a number of people do not understand fully what it is, sometimes even the symptoms or how it stays in your body, like my guest was already telling me behind the scenes. So for the next 30 minutes, I think you should stay tuned so that you can get yourself a good dose of education and enlightenment on typhoid fever. My name is Oluwaseun, and my guest was here with me last Saturday talking about foodborne illnesses, especially the one caused by E. coli. Today, we're talking about Salmonella typhi. So please make welcome with me, health educator, Testimony Adeyeye. Good morning.
Good morning. Good morning,
Thank you for joining me again. It's a pleasure to have you here.
Thank you. It's a pleasure to be here again.
All right, so let's quickly head into the conversation. Typhoid fever. Well, tell us what it is, and then we'll go on to why there were a number of misconceptions around it.
All right, typhoid fever, it's a life-threatening condition caused by a bacteria called the Salmonella typhi, right? It's caused by contamination with food. It's caused by contaminated food, water, right? People get infected by eating or drinking contaminated food and water. A number of factors causes it, right? There are a lot of risk factors attached to it: poor sanitation condition, poverty, some environmental conditions like warm, humid climate, rainfalls, and all of that. So there are various conditions that causes typhoid fever. But one particular thing that needs to be understood is that contamination with contaminated water and food, right, that's been contaminated with maybe some droplet of feces or wee of infected persons, probably through wastewater usage and all of that, can cause typhoid fever. So most importantly, it's a bacterial borne infection. It's also transmitted fecal orally. So it means that it has to be through contamination of feces, right? Feces or urine in few cases, but most especially feces, right? When people get infected, contaminated with feces, contaminated food materials.
So it's not caused by mosquitoes. It's a bacterial infection. So I'm just deliberately saying that.
No, it's not caused by bacteria, by mosquito, right? Mosquito is one that causes malaria that we're used to, right? Anopheles mosquito causing malaria. That's a protozoa, right? Why typhoid is a bacteria, so they are different. Malaria is protozoa, typhoid is bacterial, and then even the mode of transmission differs. Right, malaria is caused by mosquito bites, so that's insect bites. Why typhoid is caused by contaminated food and water. So there are two different things.
Still going further I'll ask you like I'm 5 years old questions. So typhoid is not what you get when the malaria parasites stay inside you for a bit, right?
Okay, so there, there can be a chance of getting typhoid. Now, I'll explain, right? Because when malaria invades the body, when malaria, that's the Plasmodium falciparum, which we are used to, right? The most common type of Plasmodium that infects humans, right? When it infects the body, it stays prolonged for a while, a couple of times, probably as a result of being untreated or as a result of being resistant to whatever drug that was being administered, right? It can do a lot of damages to the body, and the antibodies that it's supposed to be, the antibodies in our immune system that is supposed to counter or kind of prevent the invasion of foreign bodies into the body are suppressed. And in this situation, there is high chances of typhoid fever, right? That's Salmonella typhi, also invading the body at the same time, and the person experiences the same thing over time. So because of the similarities in the both symptoms, like that's what malaria and typhoid, the similarities in the symptoms of the both of them, a person might not even know that he's infected with typhoid fever already. We just assume that it's malaria because there's just this prolonged fever, which is the first symptoms of the both of them. That's the first symptom of the both illness that we're talking about here. So there is high chance that a person would most likely start with malaria, right? A person would most likely get infected with the malaria, and over time, a typhoid can also come into it at the same time, and the person will have a mix of the both infection.
So I'm just trying to be very careful and crystal clear with the explanation. So I get it. I'm going to repeat it to you, and then want you to draw the line. So the malaria, you've got the parasite in there. Yes, it's already doing the wreaking the havoc. And then it can prepare the way for the bacteria causing the typhoid to come in. Not that the malaria parasite morphs into typhoid, right?
No, it doesn't.
Okay.
So it's just like prepares the way, like you say, right? So, and then the typhoid bacteria comes in, and then the both of them just continue there.
Thank you very much for that crystal clarity. Now let's go to the symptoms and then the diagnosis, because I'm particular about the diagnosis.
Yeah, so for the diagnosis, so how do you diagnose typhoid fever? So in this part of the world and in most of the other places, right, typhoid fever is diagnosed using a wider tests, right? But some other occasions, it's most preferable to use a blood culture to diagnose typhoid. Why? Because in most of the cases, wider tests will give a positive, right? It'll show a positive result for typhoid fever. And because typhoid, wider tests might not be able to tell the extent of damages that typhoid fever might Salmonella typhi might have done in the body, so it might be difficult to understand the gravity of the damages. So yeah, it brings us to the fact that proper diagnosis must be done, right? There's even chances that even after a person is treated of typhoid fever and the person seems to have recovered, let me put it that way, seems to have recovered because the person feels like, I'm all right, there's nothing wrong with me anymore. And the bacteria is still in the person's system and the person is still transmitting it as much as possible if care is not taken. Right, so the diagnosis must be thoroughly done, a proper diagnosis must be done, and it must be properly treated. And even after treatment, it must be retested. The person should be retested to be sure that the bacteria is no more in the body, right? That is when the person knows that, okay, yeah, sort of the person is free, right? Because of course there are complications, which we'll talk about at a much later part of this, right? So what are the symptoms of typhoid fever? So the first most common symptom a person would experience with typhoid fever is fever, like a very high fever. That's where the name comes from, actually, because there is usually an aggravating fever that keeps going up over and over in days, right? The incubation period for the Salmonella typhi, that's the period of time between when the person is infected to the period of time when the symptoms begin to manifest, is between the space of 5 to 14 days. And within these 5 to 14 days, some people begin to manifest symptoms. And like I said, the first is fever. And then in a couple of days, fever keeps getting higher. And maybe in some weeks, then the person begins to experience some stomach-like symptoms like diarrhea, constipation, and the likes of them. And then maybe in some very few occasions, some people would experience rash, some kind of rash, small pink-like rash around their skin. So those are some of the symptoms of it. Yeah, other symptoms might include headache, abdominal cramp, of course, and all of those other things. So those are the symptoms that are associated with typhoid. But in the reality of it, most of what people experience first, like I said, is the fever. It is maybe on the later stage that you begin to experience, some people would experience diarrhea, yeah, which is in some couple of weeks anyways, like I said. So it has the possibility of prolonging itself in a person's body and takes that while. So imagine a person is infected and then the person begins to manifest fever, right? And it takes a whole week, that fever continues going higher. And then the next week, the person is just experiencing abdominal cramps. And then the person is wondering, okay, what's happening? And after the abdominal cramp, maybe that's when diarrhea sets in. So somehow, most people get to realize in time, probably through testing, and it doesn't get to that diarrhea stage, right? But that abdominal cramps definitely comes with it. So we say typhoid fever exists in 4 stages, basically, right? The first stage, which I said, the fever that manifests. The second stage, then the person begins to experience abdominal cramps, diarrhea, and some rashes. Some people experience rashes. And then at the third stage, this bacteria begins to find its way into the bloodstream, find its way into different parts of the body, and does this havoc where complications might now set in, right? Especially in the gallbladder, right? And then at the 4th stage, some people begin, of course, maybe assuming the person would have started treatment, right? At the 4th stage, some people begin to recover from it. But in the process of recovering, because of the level at which the bacteria had found its way and penetrated into different other parts of the body, the person might still have the bacteria in certain parts of the body unknown to the person, and then the person feels like he has recovered. And that 4th stage, at that point, the person might not manifest symptoms anymore, but of course, the bacteria continues to do its damages in the body. So those are basically how typhoid occurs in an individual, and those are the symptoms that comes with it, right? At that 4th stage, people most likely become asymptomatic and they assume or they think that they don't have typhoid anymore, right? Because they feel like they're fine now.
Wow. I mean, it makes a lot of sense why we keep having many cases of typhoid after, in quote, we have treated it. Okay, so before I go back to what can be done, which is pretty much you've answered, but I just want to go back to that later. Now, what's the duration of going through the stages from the stage 1 to the stage 3 or the stage 4? Typically, how many days or weeks does it take?
So it can take between weeks and even months, right? It can take between weeks and months. Yeah, like I said, incubation period is 5 to 14 days. So most likely 5 days is already almost a week. Do you get it? And then the person is beginning to experience symptoms after 5 days. And then you can imagine that at that stage 1, stage 2, stage 3. So it can last weeks into months, right? Within just for those 4 stages that we just talked about.
All right, thank you very much. Now, if you're joining the conversation for the first time, you're listening to Soul Food on Smooth 98.1, and it's pretty much about your health and wellness. That's the conversation we have every Saturday from 8 till 8:30. This morning, we're talking about typhoid fever, and we have analyzed some things about it. I hope you caught it, and if not, don't worry. You can always catch the replay on our YouTube page, which is at Smooth 91 FM. My guest is a health educator, and she is Testimony Adeyeye. Just stay with us. We'll be right back.
Music. It's music.
Let's go back to history.
Excuse me.
On January 1st, 1914, Lord Frederick Lugard succeeded in the amalgamation of northern and southern provinces of Nigeria to make up what is now the Federal Republic of Nigeria.
Nigeria is divided into 4 regions.
So when we come back, we will be talking about treatments
Diverse people become one nation.
and some do's and don'ts of it. If we have some do's and don'ts of treatment, should you treat typhoid with herbs, agbo, and all the likes?
Quality on Smooth 98.1
All right.
every Thursday from 11 a.m. Black people are more concerned with their tribe being in control than they are with liberation from foreign control. How can we get free?
My name is Adeyeye, actor,
Right, Tara?
and you're listening to Smooth 98.1. Keep listening.
Currently, you're listening to Soul Food. It's about your health and wellness, and that's what we discuss every Saturday morning from 8 till 8:30. Today, we're talking about typhoid fever, and my guest is Testimony Adeyeye. She's a health educator, and she's laid a solid foundation for what typhoid fever is, as well as the causes. And, well, we've not gotten to the prevention yet. We will. I think we've touched a little bit on the prevention since you already know how it comes into the body. So we're trying to just clear some air about what the disease is and how it enters your body. I have a message on WhatsApp from Shegun Zachariah who says, I have really learned a lot because I've always believed that the cause of typhoid is from mosquito bites. Please, I want more awareness being created through this program and through this platform. Well, we're doing our bits and we are doing our best. Would say that you share this video with someone as well so that they get educated about it. And how you can do that is by going to our YouTube page at Smooth 91 FM Lagos. So you can share the link with someone and let them watch and understand how typhoid fever comes into the body. So we've talked about the diagnosis. Let's talk about the treatments.
All right. So typhoid is treated through using antibiotics, right? But in recent times, we found out that antibiotics, we've had a lot of issues with antibiotics. I know which a lot of people are already aware of because some people are beginning to create awareness about antibiotics resistance. And because of this, some cases occur such that persons take treatment with antibiotics and it seems like the antibiotics is not working because the bacteria are resistant to it. And like I said earlier, where we have the relation between malaria and typhoid, as situations occur where people infected with malaria seem to treat malaria and then it seems like it's not going, and the person gets infected with typhoid along the line, and it feels like, okay, a whole lot, and altogether the person already assumes that the drugs are not working. Maybe they are fake drugs. I've had a couple of people tell me that the drugs outside are fake. NAFDAC needs to regulate drugs and all of those other things. Yeah, so, but because of the complexity that comes with a co-infection of malaria and typhoid, it seems like, okay, yeah, at times, right, some of the treatment or therapy given do not work. And there, some people begin to experience typhoid relapse. So typhoid relapse occurs when after treatment, a person still has symptoms of typhoid. Right. In such case, the person would need to visit the healthcare provider again. And of course, probably is going to be a different treatment option is going to be administered to the person. So basically, the treatment option for typhoid is antibiotics, right? A couple of antibiotics have used to be very, very effective for typhoid treatment management before, but now it seems like, okay, yeah, so then we get a couple of antibiotics that were used. Now we have new brands of antibiotics that are being used and new components of antibiotics that are being used to treat typhoid. But in general, yeah, antibiotics, again, which is very important, why it's very important for people to get appropriate diagnosis before using drugs anyhow. Very important, because all of these things, it would be so sad if we come to a time where antibiotics doesn't work anymore, and then we have to start producing a new composition of antibiotics, which is going to take a couple of years, and it's going to take a whole lot. So it means that for those period of time where we have to start producing new sets, a lot of people will die because they cannot be treated. So again, diagnosis is key. People should be diagnosed appropriately. Let them go to the hospital, know the kind of condition you are having, be sure that this is what is happening before you treat with whatever or whatnot.
Thank you.
That's what the treatment.
Thank you. I think it was yesterday that I saw a CDC, that Center for Disease Control, release, well, not for Nigeria, I believe America. And globally, the World Health Organization already cried about the antibiotic resistance. And it's just I don't think people understand the extent of how scary this is. How people can literally die simply because a drug that used to work no longer works as a result of people just picking up a drug and feeling, okay, this is what has worked before. Now let me take it again. I think we just, again, we'll not stop saying that, but we need to be mindful. Self-medication does not really help as much. If you have any question, do you want to add something?
Yeah, no, I was just buttressing what you said. Self-medication doesn't really help at all.
Thank you. So if you have any question or you have any contribution, the WhatsApp line is open. That is 0809-444-0981. Again, 0809-444-0981. That's for WhatsApp. And the call line is 0201-448-9981. So each time I discuss something like this, I cannot help but bring it up, understanding that our environment, we love our herbs. We love our herbal potions and mixes. Are there alternatives to drugs that you can find in these herbal potions for typhoid?
All right, so yeah, there are definitely alternatives for the orthodox drugs that we use, right? The tablets and all of that we use. But one has to be careful. So I tell people that as much as we are culturally oriented and we do a lot of our cultural things, try to use nature and all of that, we must understand that even the drugs that we use are made from some of these things, right? When we talk about some kind of drugs are made from some of these herbs. And we must understand that all of those herbs have their composition. And again, too much of everything is not good, right? Too much of everything kills, and too much of it might have complications, it might have side effects, right? It has a lot of effects on the liver, on the kidney, because it's a lot. And when you look at what people consume in terms of herbs, it's a composition of so many things without one proper analysis of the composition of each of these herbs. There is definitely no appropriate measurement of the components that are being mixed together. And when you look at it in relation to how drugs are actually being produced, you understand that in the pharmacological process of producing drugs, there are compositions, there are measurements, there are a lot of do's and don'ts. There are what to do and what not to do. How do I combine these two chemicals? How do I, and all of those processes. But when it comes to herbs preparation, how do people really go about it? Do they really know all of these details? Do they really put into consideration all of this? And then you find that when people consume over time, there are a lot of complications that are attached to it because we overwork the kidney, we overwork our systems, and in the long run, there are complications and there are damages that comes to follow it. So, but basically, yeah, if there are, personally, I don't use herbs. I don't discourage people who do, right? If you do, and most important thing, we caution, right? It mustn't be too much. Yeah, I've heard a couple of people say guava leaves can help to kind of fight malaria and all of that. Yeah, maybe not, right? I've personally not done my thorough research on all of that and to ascertain whether or not it does. But I know that there are some herbs that can fight those conditions, and most importantly, we must be careful. Be even sure of your diagnosis first. Just get to a diagnosis first. That's what I encourage people to do. Before you are treating something, what makes you feel this is? Again, like we said, some of these conditions have very similar symptoms. So you talk about malaria, you talk about fever, you talk about chills, you talk about headache, you talk about muscle cramps, and all the likes. Yes, some people have malaria and then they mistaken it for typhoid. Why? Because they have fever, right? They have headaches, they have you see that the symptoms are very similar. So you talk about typhoid, you talk about fever, you talk about headache, you talk about abdominal cramps, you talk about diarrhea, yeah? So malaria, you also talk about fever, you talk about chills, headaches, and you see that there is very, very high similarities between the both of them. So until you're able to diagnose which is which, and then you are able to treat appropriately, that's the most important thing. And because, yes, like we said, there is high possibility of co-infection not malaria leading to typhoid, like we said earlier, or not a mosquito bite causing typhoid, but a correlation in the sense that in this part of the world where we are, especially countries like Nigeria and other tropical countries, where we have so many conditions that we are characterized by, including environmental conditions, poor sanitation, poverty. So you can understand why there is a mix of the both condition in most of the time. So most importantly, diagnosis is key. Yes, so there's a chance that a person can be diagnosed and then they find the presence of Plasmodium falciparum in the person's blood, and then they equally found Salmonella typhi in the person's blood. So yeah, in that situation, there can be a treatment for malaria typhoid, where we are always used to people go to the hospital and they say, I have malaria typhoid, I have malaria typhoid, and all the likes. So yeah, that's where such cases occur, right? And that's the most important thing is proper diagnosis. So
Are you there? Can you hear me? Oh, okay, so I can see your mouth move, but I can't hear you. Can you hear me? Oh no, I can't hear you. I can see you nod and say that you can hear me, but for some weird reasons, I can't hear you. And I need you to be able to speak, because this next question I want to ask you, I need you to say it. So is it possible for you to move or disconnect and then come back? Okay, I can hear you now. Can you do that again? Can you unmute and can you say something?
okay, can you hear me now?
Relief. Yes, please, I can. All right, so I'll quickly take a call and then go back to the messages. Hello, good morning. Thank you for calling. Do you have a question?
Yes, I do have a question and a commendation.
All right, please go ahead.
The Dr. Ingrid has spoken very well and is very factual and realistic. The main thing I can gather from all said and done is the aspect that one needs to be diagnosed and to know the difference between typhoid and malaria. But the thing is, I would love to ask is that talk about some herbs or some trees or this. Can she please dive a little into those cures about using some herbs, because she's been practical? Thank you.
Thank you. I believe you already mentioned it. So he asked about some herbs. You already mentioned or your stance on herbs, right?
Yeah. So I
Yeah.
already said that there might be some apps that works, right, which some people do use. But again, a person has to be careful of the kind of app that you're using, because we cannot ascertain we cannot verify how effective or what do these herbs contain, right? And because of that, and the whole effect that comes with using herbs, one has to be careful. Right? It's not medically proven, right? It wasn't produced under a medically supervised environment. When I talk about supervision, I mean that there's all the guidelines for producing drugs, right? Because of course we would call such drugs because it's meant to treat a particular condition. So as all the medical condition and supervisory guidelines to producing the herbs, was it followed, right? Was it under thorough analysis of all the components that's supposed to be used, all put together? So all of those things, we understand that it's a whole lot of complex thing, and one has to be very careful. So personally, I don't disapprove of it, but again, I tell people to tread with caution. Take your diagnosis serious and know what you're treating.
I'm even more concerned about those herbs that you buy outside, because one of the scariest things is
you don't even
know the solvents that was used. Is it water? Is it contaminated water? Is it alcohol? You don't want to complicate things for yourself. So please be careful, very careful. And the quantity, the issue of dosage is also one very important part in administering and taking herbs. Now, the final question, which I said I really wanted you to answer, is from Shegun Zachariah. And I'm glad he asked this because for some reasons I forgot. It was one of the questions I was going to ask because it's one of the things you hear from people. So he said, can taking of drip and appropriate drugs flush out typhoid?
All right, so I think that's also one of the misconceptions that people have. Some people believe that when I take drip, it flushes out all the rubbish that is in the body that causes typhoid or malaria, whatever, whatnot. Oh, well, it's a misconception, like I said, again. Yeah, so taking the administration of drip, it's actually for different purposes, right? So in a situation whereby the bacteria has really invaded the body, right? And it feels like, the difference between taking drugs and then using IV, that's where how the drip is being administered through the intravenous route. The difference is because that goes directly into the bloodstream and does the work, right? That is where the drips comes in, right? When a lot of they found out that maybe due to diagnosis that was made, they found out that a lot of this infection has done a lot, and the extent to which it's in the presence in the body is much on their eyesight, right? And that's where you would see a person would be placed on an IV. Yeah. So why? Because the IV would work directly in the bloodstream. Again, maybe I forgot to mention, when Salmonella typhi affects the body, it affects the gut, which is the intestine, and then of course affects the bloodstream as well. So at that later stage 3, it begins to penetrate into the bloodstream. Are we together? So that's where the issue of IV comes in. So probably in the stage 1 or stage 2, when it's been diagnosed, it probably might not be prescribed. IV treatment might not be the option, right? But when it gets much and the presence of the bacteria is much in the body, then they begin to administer an IV treatment as the option for IV fluid as the option for the treatment. So, but most importantly, a person must understand that when you diagnose, early diagnosis is important. When you begin to feel high fever and then you're wondering what is wrong, get a diagnosis. If fever persists for 3-4 days, you begin to understand that, okay, let me know what it is, right? And then you're able to treat accordingly. Yes, IV fluid is not supposed to flush, it's not the way we think it, or it's not the way the general public think it, that it flushes the bacteria. Yes, it does the healing that way, right? Directly in the bloodstream, because in the complications of typhoid, we have issues with bloodstream, right? A person can develop certain blood-related issues, thrombocytopenia, which is a situation whereby the platelet is not working or is not being produced as it should produce. It can also cause gallbladder issues. It can cause respiratory issues. Those are some of the complications that come with typhoid. So that is at the complex stage, right? At the stage 3, going towards stage 4. And that stage 4, we said again, some people become asymptomatic and they might not experience symptoms. And of course, it does its damages until the person gets a retest and find out that the person is still having the bacteria in the body, right? And again, it brings us to the prevention. So what I want people to understand now is get diagnosed. Don't assume, right? Don't go to a hospital, right, or a health center with a particular thought of what treatment option you want, right? Some people get to the hospital and tell them that, okay, I've been feeling this way for a couple of days now, and I want a drip, right? I wanted to, especially those people that patronize this home quack nurses, right? Like they have those things in their mind already, and that's what they want to do. Get diagnosed, know the best treatment option based on your diagnosis. That is when you can actually say, sometimes some things are not needed. Again, brings us to resistance of all of these things that we're talking about. Some things are not needed. When they are not needed and you use them, you find out that those bacteria become resistant, those microorganisms become resistant to the treatment option you are prescribing at that point in time, because it's not necessary at that point. right? At this point that you are, this is what you can take, right? It has not gotten to the stage that this is what you should use, right? So why that stress? For me, I mean, why that stress? Why would I want to go through that drip process when I could just take a drug, certain antibiotics to, I mean, combat the issue altogether at the first instance? So again, I will just wrap. I'll just say something around prevention. Like we said, since at the stage 4, a lot of people have this thing and it stays in their system for even up to years and even more than a year without them knowing. It is important for us to take precautions. Everybody needs to adopt and get used to proper hand washing. Why? Because maybe in the Nigerian person that we have, the Nigerians that we have, would not, most likely would not finish treating a condition and go for a post-test. So how many people would go for post-test after treating typhoid, for instance, to find out that the bacteria is no longer in their system? So except we can be assured that a lot of people would do that, we can be sure that, okay, yeah, when a person does a post-test and then they certify the person free from Salmonella typhi, for instance, and the person is free that, okay, whatnot happens, I am not transmitting this bacteria for the longest time that I'm not even aware of. So that way we are able to prevent it. Hand washing properly, cooking food thoroughly, ensure that when you're sick, you're not cooking, or you do all the necessary precaution. And then again, the most important prevention for typhoid is there is vaccine. There is vaccine for typhoid. So people would not concurrently come down with the bacteria over and over again. So there is a vaccine for, I'm sure many people are not aware about it, but there is a vaccine for typhoid. It's called the typhoid conjugate vaccine, and it is given for people that want to travel to typhoid and malaria endemic nation. Although it would not, the vaccine would not be effective for malaria, yeah, like we're saying, but it will be effective for typhoid. But I'm just saying it because most countries are endemic for both conditions at the same time. So there's typhoid fever that can be used to prevent. Yeah, so it doesn't necessarily mean that a person that is vaccinated for typhoid, against typhoid fever, would not come down with typhoid fever, but it would not be as severe as a person that was not vaccinated at all. So I think people should begin to take the vaccination as an option rather than a frequent and reoccurring typhoid cases that will require over and over treatment.
Thank you. Thank you so much for that lengthy and detailed explanation on the prevention and what to do, especially the vaccine. Very important. Now, this one, I'll need you to answer it in 30 seconds, if possible, 20 seconds. It's from Josiah. He says, "Good morning, doctor." Well, they have crowned you doctor this morning. She's a health educator. She's not a doctor. How do you see drugs adverts that says if symptoms persist after 3 days, consult your doctor? Does this not suggest self-treatment? Shouldn't we consult doctor before taking of the drugs? Much on malaria drugs, we hear this advert always. So quickly, what do you say to that?
All right. So I think it's a misunderstanding of what the advert actually says. So the advert is saying that after 3 days of treatment and symptoms persist, see a doctor. You are supposed to have seen a doctor to even get to use that treatment option in the first place. So you have seen a doctor, you have been diagnosed, and you've been prescribed a particular medication. And if symptoms persist, like we talked about typhoid relapse. So in a situation where there is a relapse of whatever condition, you have to see a doctor again before you can know what next to do. So, but in most cases, they might have to retreat, maybe with the same therapy or maybe a different therapy altogether. But those adverts, it's just a misunderstanding of what the adverts mean, because definitely you need to see a doctor first before treatment. Very important. You have to get diagnosed before treatment.
Thank you. And I'd say, in addition, I think there are some over-the-counter drugs. So most times you might also see that for over-the-counter drugs that you might not necessarily need a prescription for, if I'm correct. So in the cases of over-the-counter drugs, yes, they will definitely write it there. For instance, paracetamol, you're not supposed to take it beyond a period. If you do, then it shows something is wrong. So for those ones, you're going to definitely see it on the packs. And yeah, she already explained it. Thank you so much for your time. And taking the time to explain everything in details. I enjoyed this and I look forward to more. Yeah.
Thank you so much for having me. It's a pleasure to be here to explain all of those things so people need to understand.
Thank you. And you can follow her across social media platforms, I believe, at Testimony Adeyeye, right? Oh, you're muted. Okay, that's fine, right? Okay. So on the other side, which is in some seconds, actually, I'll be joined by the children between 6 to 15, and it will be Curious Minds right here on Smooth 98.1. If you're just joining the conversation, it's ended, but you can go to our YouTube page at Smooth 981 FM Lagos is the YouTube page. Go watch it and share with some family and friends so that they can be educated on typhoid fever.
And the rest will follow.
You start with figuring out.
Ooh, we totally ate into the time. But thank you.
Thank you so much.
Healthy body.
It's a pleasure.
For having me again.
On Smooth 98.1.
So I'll share the video with you. I hope I don't forget this.